Palm Beach took a big step forward in returning our city's water supply to normal. This morning, in conjunction with the Florida Department of Health and the Florida Department of Environmental Protection, the city of West Palm Beach finally lifted the drinking water advisory for infants, young children under the age of 6, and other vulnerable populations in the city of West Palm Beach, the town of Palm Beach, and the town of South Palm Beach, which was first issued on May 28th. Water quality samples collected on June 1st and June 2nd showed cylindrospermopsin, a toxin produced by blue-green algae, in the tap water at levels below the detection level for the Florida Department of Environmental Protection laboratory. The levels are less than the U.S. Environmental Protection Agency's National Health Advisory level for vulnerable populations. Residents may resume using the tap water for all purposes. Let me repeat, residents may resume using their tap water for all purposes. In just a few moments, Dr. Poonam Kalkat, the City of West Palm Beach Public Utilities Director, will detail specific recommendations for vulnerable populations listed in the advisory as to the steps that they should take for their water systems and small appliances now that we've lifted the advisory. All I can say is that the lifting of this water advisory is great news for our city, our utility, and our valued water customers. I want to thank all City of West Palm Beach water customers, first of all, including the town of Palm Beach and the town of South Palm Beach for their patience this past week. I know it has been a long week. Again, I apologize for the interruption of service to those under the advisory. We understand that you have trusted us with your safety, your family's safety, and the safety of your business. To us, that is a sacred trust. We value that trust, and we value you. We understand the importance of clean, safe, and reliable drinking water to our customers and to our residents. Your safety is why our utility regularly conducts tests that aren't even required by regulatory agencies. Your safety is why our utility was proactively testing for an emerging toxin for which it is not even required to test by state and federal regulators. Your safety is why we even detected this toxin in the first place, and why, after confirming the high-level test late Thursday, we worked with the Florida Department of Health to notify the public on Friday. Your safety is why it's so important that we fend off any threats to our water system, whether it's State Road 7 or blue-green algae in Lake Okeechobee and the regional water supply system. I want to underscore that our utility, once it confirmed the presence of the toxin in our drinking water, responded appropriately by following all Florida Department of Health and Environmental Protection Agency guidelines. It is because our utility did the right thing, took immediate action to mitigate the situation, and followed the EPA's 10-day health advisory that, to my knowledge, there are no confirmed cases of illness resulting from the toxin in our community. You know, while it's easy for people to Monday morning quarterback and second-guess decisions, and let me assure you, we will conduct our own internal assessment of how we can improve as an organization. I do want to thank Dr. Kalkat and our Public Utilities Department, including the lab scientists, not only for their response during this unprecedented time, but also for all they do to ensure our residents and our customers have safe and reliable water to drink. I have directed staff to establish a panel of experts to determine interim and long-term strategies to ensure this does not occur again. I also want to express my heartfelt thanks to the Florida Department of Health in Palm Beach County, particularly to Dr. Elena Alonzo, who was away on vacation, but I was talking to her into the late, even as recently as late last evening, as well as the team at the Florida Department of Environmental Protection, who work with the city every step of the way, from public information to the science and data, to lift the advisory and to help us get where we are today. Now, I do have to make one correction. On yesterday, I stated that it was the Department of Environmental Protection that seemed to be slowing down the issuance of lifting our advisory. I did learn this morning that it was indeed, that was misinformation. So I apologize to the hardworking team at DEP, and again, thank you. We do appreciate all that you do. You know, as we said before, in the state of Florida, there simply is no playbook for handling this particular toxin by utility. We will be sharing our experiences over the last 2 weeks with the DOH and DEP as they work to develop guidelines for Florida utilities. Given changes to environmental conditions, I predict that this will not be the last time a utility in Florida hears of this toxin. I want our experience in the city this past week to be a force for good. My hope is that our utility and utilities across the state can learn from our experience and that any necessary regulations, if needed, are ultimately implemented. I also wish to extend my heartfelt thanks to Chief Brent Bloomfield and Parks and Recreation Director Leah Rockwell, who were able to establish and operate our water points of distribution on very, very short notice. In 7 days, we distributed 335,564 bottles of water. That's 216 pallets. We distributed to nursing homes, assisted living facilities, schools, homebound residents who are over the age of 50, the Housing Authority, several non-profit institutions and homeless shelters. It was because of the city employees, the United Way volunteers, and vendors such as Sam's Club that we were able to make these points of distribution possible. You know, when learning of the task at hand on a holiday weekend, our city employees did not bat an eyelid. They leaned into the responsibility, the challenge ahead, and I'm so proud of them. They were there for the City of West Palm Beach organization, our residents and our businesses when we absolutely needed them most. Chief Bluefield is joining us this afternoon. In just a few moments, he will speak about the POD effort. Thank you again, Chief. I also wish to thank again Palm Beach County Sheriff Rick Bradshaw for making his team available to fly our water samples up to Tallahassee for testing. This greatly expedited the return of results. I do also want to thank State Senator Bobby Powell, Palm Beach County Commissioner Matt Bernard, and Palm Beach County Administrator Virginia Baker, and County Commissioner Greg Weiss as well, who all offered their assistance to the city in our time of need. When I reflect on the past week, it truly took a community to come out on the other side where we find ourselves today. For the West Palm Beach community and our partners, I will be forever grateful. But please know that we will use this experience as a learning experience. There are lessons to be learned, and we want to take advantage of this opportunity now that we have gotten the advisory lifted. We don't want to just return to business as normal without taking advantage of the opportunity to look at our performance over the past couple of weeks and learn how we can be better, how we can do better. So at this point, I would like to introduce Dr. Poonam Kalkat. Dr. Kalkat.
Thank you, Mayor. Thank you, everyone. I really appreciate all of you waiting, bearing with us, working with us to make sure that we were able to provide you the right information at the right time. And sometimes that required patience because we needed to make sure we were getting the information from Department of Health, getting their confirmation and approval, as well as DEP. So right now, everyone can resume using the tap water for all users. It is recommended that customers that are on the vulnerable population flush their water faucets for 5 to 10 minutes to try and get any water that may have been sitting, if it hasn't been used during the advisory, to get it out of their plumbing. By running all hot water taps as well as cold water taps. Open any remaining fixtures such as hose bibs, external faucets, or fixtures not used for drinking for at least 5 minutes to finish the plumbing system flushing. Customers in these vulnerable populations should also change water filters, including the ones that are on the refrigerators. If they have any ice makers or water dispensers, throw away all the ice. Empty and clean any devices or small appliances like vaporizers, humidifiers, CPAP, pet water, coffee makers, or other healthcare devices that may have come into contact with the water during the advisory. And throw out any food, drinks, baby formulas and medicines that were made with or came into contact with the water during the advisory. I also want to let you know the city will actually increase its routine sampling activities for cyanotoxins in the raw water as well as finished water. And we will work very closely with Department of Health as to whatever their recommendations are. And like the mayor said, with the Department of Environmental Protection for any future as to whatever the playbook is given to us and the guidance that's given to us. I think next is.
Good. Brent, please, talk to us about the process.
Good afternoon, Assistant Fire Chief and Emergency Manager Brent Bloomfield. So I just want to give you a quick update on kind of what the mayor already said, but we did go through 335,564 bottles, 216 pallets, at a cost of $63,493. We also received 14 of those pallets from Palm Beach County DEM. We're grateful to them for that. We did distribute to multiple places, not-for-profit organizations, homeless shelters, even the Housing Authority. We distributed water to them as well. We are thankful to the mayor. The EM team is thankful to the mayor, city administrator, the city commissioners, and also the city leadership who trust us to make things happen and let us do what we have to do to make the city as safe as possible. To kind of give you a quick timeline, on Saturday morning, starting at 6 a.m., we started acquiring water through several different locations throughout the city, Home Depot, Cheney Brothers, and then we ended up at Sam's, and Sam's was a great partner for us. They actually had enough water to sustain us for the first several days through Monday, through the holiday. We didn't have a lot of vendors that were available throughout the holiday, so Sam's was a big part of that. Then on Monday, we decided to spread out our dispensing to other locations. We ended up doing Coleman Park, Phipps Park, as well as Gaines Park. The reason why we choose Gaines Park as a location is because it's a centralized location. It's already an approved pod for after hurricanes, and we already have a MOT plan for that area. We've been asked, on occasion, why did we choose Gaines Park, and that is the biggest reason why, because logistically it is the best place for us to do a pod in the city. I would like to also extend a special thank you to Sheriff Bradshaw and PDSO Aviation Division. I was part of that, going over there and making sure that we were loading the water samples and taking them up, and they were fantastic, and they did a great job for us. I want to especially thank the city employees in the United Way, because without them, we couldn't have made none of this happen. They gave up their Memorial Day weekend to come in and help the city, and this really does show when we all come together as a city what we can accomplish, and we can accomplish great things. And I just want everybody to understand that, we had up to 90 employees this last weekend over Memorial Day that gave up their weekend so that they could make sure that we got the water out to as many people as possible. So I just want to make a big thank you to them as well. So thank you all, and I appreciate it.
There is one final thank you I want to make, and that's to the media that's in the room. Without your help, we could not have gotten our message out as broadly as possible. So thank you for helping us to communicate with our public during such a crucial time. And with that, we'll take any questions.
I have a question for Dr. Papa as well, and I probably have a follow-up as well. Dave Bowman, WPB-TV. Specifically, what have you done that in layman's terms that they might understand to reduce the chances of this happening again?
So a couple of things we have taken care of. We already monitor all our conveyance canals as well as watershed. We also check upstream of where we get our regional water. So before taking any regional water, we check that on a regular basis too. So we are going to continue doing that. And if we see any kind of algal blooms or algal growth, we immediately isolate that area and treat it so that we don't have any chances of anything coming to the plant. Besides that, we have started the eastern well field and the western well field, which are groundwater sources that can bring water into the surface water to blend, reduce some of the increase actually some of the conductivity, decrease the pH, all of those things that help. And groundwater does not have algal growth. Once it comes out and it's in the system, it could, obviously based on whatever the conditions are. But that really helps mitigate any bloom activity if that's going on. Besides that, we have continued to use powdered activated carbon in our treatment system as needed. So if we see any activity of algae growing near our intake of the plant, then we go ahead and start adding PAC as needed. And we can change those doses too. Then we also have what we call post-chlorination after the filtration system. So what that does is there is a contact time with free chlorine before the water goes out into the system, and that will take care of anything that might have made through the filters and through anything on the sedimentation basins and so on and so forth. And last thing that we are doing right now is free chlorine in the distribution system. We will probably start backing off from the free chlorine in the distribution system in the next couple of days, but we will be monitoring very carefully how our system is doing while we do that.
A follow-up to that, obviously you shut off or reduced some of the water from places like Clear Lake, I guess, and have more groundwater. What kind of supply of well water, groundwater, if you will, do you have? And how long can you really sustain going on that before you may have to switch back to the original mix?
So we do have in Clear Lake, we actually started what we call our Australian divide structure pump. So basically what we do there is we get pump water from really deeper depths of Clear Lake into the plant intake. And we had actually started that before we even saw this algal toxin come into the plant, because we were seeing the conditions of lake dropping, conditions of where you might end up having some kind of algae growth. So we have started doing that. So we are going to continue doing that. That helps, instead of taking water from just the surface of the Clear Lake, it's now coming from the deeper depths. We have 2 well fields. There are 10 wells on the eastern well field, which is just alongside M Canal, and we have a western well field that are deeper wells, and we have 10 wells there too. We are already throttling back the wells as needed, and we'll continue working with South Florida Water Management District to see how long do we need to continue using those wells. We are also, as rain comes down, as the rainy season starts, that starts helping bring your surface water up. And when you have that when you don't have a static system, and you don't have standing water and really water going down in these reservoirs, you have less chances of algal blooms. So all of those things will help.
Dr. Pelkat, Michelle here with WPTV. Can you just, I know you mentioned earlier that you did have conversations with the Department of Health to now have more routine testing for this specific toxin. Can you explain to our viewers, is that maybe every week as opposed to once a month we were doing before? What is that going to look like now?
So we are still talking through the details of that. Right now we're going to continue, we are doing daily sampling until we get a couple of days of samples where we've already gotten the lift advisory based on 2 consecutive days. We are looking at 1 or 2 more days of where we get clear samples, so we can go to weekly sampling from there. From weekly sampling, again, when we get a couple of consecutive weeks of sampling, we can go to bi-weekly and monthly, depending on that. But we will also continue monitoring what we can. We've also bought the lab at the plant, at the water treatment plant, has actually bought some ELISA kits that we are going to buy. ELISA is just one more technique that can be used for looking at these toxins. So we are working through a contract right now to get the training and it may be a semi-quantitative, quantitative method. It sometimes gives you a little bit higher readings. So we are working with DEP as well as other labs to see what works and continue to talk to the scientists who work with this toxin much more than we have and see what they recommend. And like the mayor said, we are going to have an expert panel. We're going to look at all of those things, and anything that anybody brings to us, I'm not disregarding anything. I'm going to look at that, and I'm going to have our expert panel look at that too and figure out what are the best means and methods for us going forward, short term as well as long term.
Mr. Mayor, I'm Jay O'Brien, CBS 12 News. If we could ask you, we know that you've got your expert panel, but based upon what you know right now, is there anything you would change in the city's response to this?
Well, I'd rather look forward than backwards. There are lessons learned, and before, I throw out a very quick response to that, I do want to get a team of experts in. And as I said, I want to take advantage of this opportunity for us to learn lessons. So I don't want to give haphazard immediate responses. I think I said yesterday, in terms of my communication, I regret not having spoken directly with the mayors of the town of Palm Beach and of South Palm Beach. As a matter of fact, today I did call them before the advisory was lifted to let them know that that was happening. And to Dr. Coolum's point about the panel of experts, I invited them, if they knew of anyone, any experts that they felt comfortable with, to please bring them to our attention. I want them to feel like they have a seat at the table as well. They're two of our best customers, and so we want to make sure that they feel that they're a part of this. So those are some lessons learned for me personally. Also, I could have been more aggressive with getting information out to my commissioners. So those are lessons that I've learned personally. But as for the city itself, we will take a very close look, not we ourselves, but we'll get an outside experts in to advise us on best practices and how we can move forward. I'm also giving serious consideration to having an expert help my administration to look at itself, whether it's communications with agencies, whether it's interdepartmental communication, whether it's communication between with commissioners, so that we also, so there'll be an external group looking at what we're doing with the water system itself, and then another expert consultant that will come in and advise me as the mayor and the administration on how we can do a better job and become better at what we do. Listen, life is all about learning, and we hope to be better tomorrow than we are today.
I just want to.
Can you clarify what the confusion was? Yesterday was waiting on the Department of Environmental Protection, and you mentioned today that that wasn't the case. Can you just clarify that for us?
As I understand it, and Poonam, you might want to jump in here. I was advised yesterday with DEP, and as I understand it, was really the State Department of Health. So it was a state agency, it was the Department of Health and not the Department of Environmental Protection.
They wanted a third day of a sample, or what exactly?
No, what were they looking for?
No, basically, the State Department, the local county health department have also issued an advisory, a health advisory out, which is not usually how these health advisories have worked in the past for us. So when they had issued that, they needed to lift that before we could lift ours. And so we needed to wait for them to get that action done, and that they took a little bit of time to look through everything, look through the data before they didn't require us to do anything more. But it was just that they were waiting to get some of that data, looking at it more carefully, when the State Department told them that yes, local county health department can lift that advisory. As soon as they lifted it, within minutes, we were ready to lift our advisory, and you might have received both advisories pretty much a couple of minutes apart or so.
Steve King, WPB-TV News. People in the vulnerable populations, if they did drink any of the water, is there a certain amount of water that is considered dangerous for them to have consumed if for some reason they didn't get the message over this last week?
The EPA guidelines say that 10 days of advisory, which basically is that the levels that we were seeing, if somebody, even in the vulnerable population, was consuming that for 10 days, that should not be harmful. Again, I can't say that because I don't know what vulnerabilities people have. Physicians are better equipped to say something about that. But once we started putting free chlorine in the system, and the free chlorine got out into the system, which was probably by Sunday or so, we would have already started taking care of the toxin and removing the toxin from the distribution water system.
Doctor, one of the things you mentioned today are the steps people can take. Among them, flushing the system, throwing away ice. Most of them seem to be relatively easy things to do, except changing filters on that. I don't know what the price of filters are, but I've changed filters, and they can be a little bit more work. Is there any danger if somebody takes all the steps that you recommended but doesn't change the filters? Is there any level of risk involved?
Based on the advisory, based on the lifting of the advisory, based on what Department of Health has told us and what EPA guidelines say, I would stick to changing those filters also, because they may have, if somebody was using that water and they are vulnerable and that water got into the filters, that could be a possible way of, that could be endangering their health, so I would not advise.
Mayor James, can you comment on the city's notification system? I know a few hours after the media advisory went out today, an email and text also went out to residents. Can you talk about whether or not those gaps in between the media advisories and those alerts will kind of shorten over time in the next, if there's ever another situation where you have to get communications out?
We will work on that. Again, we will look at communications as part of our internal a review of our processes, and, you know, try to, become more efficient. Again, I can't overemphasize the fact that the city will be taking advantage of this experience. We'll try to make some lemonade out of the lemons. The lemons were what people had to go through over the past week. Very unfortunate, but we don't want this opportunity not to go, for us to learn lessons and be better next time.
Mayor.
Yes, sir.
Question about the water. I think it was you that mentioned that it was $63,000, and what I'm wondering is, did the city get water donated to it, or did it bought the water for $63,000, the water that we distributed?
Most of it, right? I mean, we got some from the county.
Yeah, so the $63,000 is what we spent on the water that we purchased. We had another 14 pallets that was given to us from Palm Beach County Department of Emergency Management as well.
Okay.
So the majority, the brunt, 180 or so 190 so pallets was what we did, we purchased.
And I imagine water distribution ended today. What happens
Yeah.
to any leftover water that the city might have purchased?
We actually are gonna keep that in reserve for hurricane season. Hurricane season, of course, started this week as well, so, we keep that in reserve for our upcoming, if we have to open another pod after hurricane season, or if we have to internally have water because of hurricane season for the employees.
Mayor, I had another question about the Department of Environmental Protection.
Yes.
Did they reach out to you and say, hey, look, you know, you pounded on us in the press conference and it wasn't us?
No, they did not reach out to me. How did we find out about that? They found it on you?
Yeah, I got a call yesterday from DEP asking me why did we say that DEP was not helping us, and I told them that's what was the information that we got. So I talked to DOH and DEP, and finally figured out that it was DOH at state level that wanted to look through some things a little bit more before they would be able to release their lift their advisory, and before we couldn't lift our advisory before they lift it, because that would cause more confusion.
Okay. Mayor, where is this $64,000 coming from, and what kind of a bite does it take out of whatever budget it's coming from?
I imagine we got that from our reserves. Actually, there may have been some reserves in utilities, I'm not sure. But our city administrator, who was very adept at finding funds when needed in emergencies like this, will figure out which bucket to pull it from. I don't know specifically which bucket we pulled it from at this time, but obviously it was money we had to spend. I mean, there was no reservation about doing that. As to the impact on the budget, we have sufficient reserves, over $6 million in the general fund reserve. So, although we'll fill the $64,000, it's not fatal.
It was 63 or 64?
63.
Yeah, 63, 8, actually I got it right here, exactly what it is. $63,493.84.
Right, let's go, 63,000, it's a change. Anything else? All right, well, I would like to say, because I couldn't say it yesterday, we were very happy, we're delighted, and we wish everyone a very good weekend. Thank you.